New videos every day.
All right, this is Athena Jezik, and we're going to continue this series today with some shoulder work. A lot of us carry a lot of stress in the shoulders. The shoulders tie into the neck. Sometimes makes the neck stiff and sore. So anyway, we just basically, like in the previous videos I've shown, is to just get a feel for what's going on with the muscle around the scapula. The scapula is the shoulder blade. That way you can tell how tight the muscles are, and if there's any twisting in them, just kind of what the work needs to do for them. And you also want to go along the shoulder blade and check the muscles there, and the teres muscles. And if they feel fairly pliable and good, then that's good. If they have some hard spots or bumps, or they feel like washboards, then you know you have something to deal with. Over on this, the right side is a little bit bumpier. It's been probably used more. But even oftentimes one side of the body will be a little more developed than the other, so you want to keep that in mind, that sometimes there's just more muscle density on one side than on the other. Okay, now to get the shoulder work nice and deep, you want to go underneath it, and there's ways of doing that. You can put the hand up here, but some people are pretty short down in the anterior deltoid area, that makes it kind of painful. And so rather to do it painfully for anybody, I just avoid doing that particular thing, and instead I will slip my hand underneath the shoulder this way, and I can push the shoulder upward, and you can see the rise and fall of the scapula as that goes. It's good to shake a little bit if you can do gentle shaking. And I'm just pushing up and down on her shoulder while this is happening. It relaxes. You can go up and down with it. You can go forward and backward. And then you can just lift up the scapula and pushing it upward, and then slide the fingers on the other side underneath. And you can pick it up more. Now here's where it becomes a little bit trickier to hold that scapula while you drop it, but there's a very nice way of getting under deeper. And not everybody will have this kind of lift to their shoulder. Some people wing up really easily. Some people, particularly people who bodybuild and build up their shoulder muscles, they're much tighter to lift, so you might not get the winging. But you'll still be able to feel the muscle, and you can get under. Usually that you can only get under along the ridge of the muscle, along the ridge of the bone when it's real built up with muscle, instead of actually going underneath the scapula, where you're actually down inside to the subscapularis. And I like to turn my fingers up and kind of feel the edge there of that subscapularis. Now there's another way you can get to that too. Here's the scapula, is to go under this way. Now you want to be careful. You're kind of in the armpit there, but you're lifting up under, and you're not poking. You want to be real careful. Use the broad part of your thumb. You don't want to poke. You want to give it a big surface and lift with it, like you're pinching onto something. And you can get to the subscapularis muscle from that direction. And that feels real nice. That's an area that oftentimes is missed along the side here, and probably because a lot of times there's ticklishness that goes on here. Now here I'm pulling, this is part of the trapezius muscle, pulling it outward and getting under it. And of course there's skin and a little layer of fat, body fat, which we all have, that also is coming along with that muscle. Okay, and then it's nice to also go across this direction, because that's the direction the rhomboids run. You don't really palpate those. They're deeper, but energetically and intentionally they can be accessed. And as you learn more about how to move energy in the body, which is something that's going to be taught in my teaching series, the more energy that you push into somebody, the more response you're going to get from the body. So that's that side, and let's do the same thing on the other shoulder. I'll just start by bringing her arm up, and then we're going to go underneath here, and we go, shaking it a little. Now this side I'm doing it a little bit differently because I'm shaking it as I'm moving my hand along the shoulder. As your hands develop, particularly you people that are out there going into this field, as your hands develop, you'll be able to do a lot more all at once, but I'm going to encourage you to do simple things and be thorough with it rather than move into more advanced kind of work with both hands, where you're connecting the two things until you get a good feel for the body. Because once you get a feel for the body, you're going to be able to maneuver yourself better with much more hand control and understanding about what's connected to what. And also how to find what's connected, and also finding where the hang-ups are, where the restrictions are, because you can begin to feel that through the fascial structure. Some of it is an energetic, but it's very obvious when you know what you're looking for. So we're going to bring this underneath again, and I'm going to pinch this up again underneath, and there's the scapula, way under there. And I'm just rotating so you can see there's a lot of things you can just play with. You just want to be really careful and pay attention to anything that's there. If you're moving the body in a direction that's good, it's going to feel easy. Oftentimes, if it's going to hurt somebody, they'll tense up a little bit, so you'll have a clue. But all of that, you have to really connect in. It's about connection. You'll be much more valuable with your work if you can connect into that body and really get an understanding. And everybody's different. All their injuries are different. All their stress patterns are different. So it's not something that one size fits all. You have to be adaptable, and yet there's still very much of a similarity to everything that you're going to be doing. And up into the neck, and then across the rhomboid area. Okay, so that's the upper back, and then if you want to move into the lower back from that, I had a question about scoliosis. There's a lot of us that have a minor scoliosis. Some scoliosis is caused from braces on the teeth. That has to be explained because it doesn't make sense, but it has to do with the dural tube and the cruciate suture and the flexion extension of that cruciate suture. And some scoliosis that people are born with is of more serious type. The scoliosis from braces has an easier chance of being more corrected than some of the scoliosis that is from birth, where there's a lot of twisting and weakness, although craniosacral will still help with some of the discomfort of all of that. And here I'm just going along the hip ridge to feel what's going on. There's a lot of times that this area of the body is a stable area. There's a lot of connections because there's attachments from the upper body and the lower body, and we can also bend in half here. So these muscles oftentimes get strained, and when you feel a strained muscle, it feels like you're rubbing across those little packing bubbles. Kind of feels like that, or it feels washboardy. And that's the stuff you want to work out. So I work it out by working the muscle in a couple different directions. Upward, which is more with the muscle, and then cross the fiber. And after doing that a few times, I notice that these little bubbles tend to disappear. They get worked out. They're little knots or little snags. And of course, the spine is always a really important area to relax. I think it's important to get close into the vertebrae where the attachments are, possibly stimulating even a little bit of the nerve root. Indirectly, anyway. And this is a little vibratory thing. Now, when you're working on the shoulders and the back, well, we'll just say going back up to the shoulders, sometimes there are problems with down into the elbow, and you can take the work down into the elbow and find out what's going on. There's a lot of things that do go on with the elbow, which is oftentimes a little torquing of the bone, inflammation that might go along with it. Little lymphatic drainage works well when there's that kind of situation, to make sure that there's not a gelatinous lymph around the joint capsule. And then oftentimes you can set to see how the elbow is aligned with the body by just feeling it and then moving the shoulder around a little bit. You can sometimes get a little guide on how that's working. It's normally better to do this with them face up, so their elbow is bent up, but it can also be done this way. It's just like steering it, but you're following the anatomy. You're not directing it, you're following it. So if there's problems there, and then up into the tricep area is another good place to work, where there's elbow problems, as well as the bicep on the other side. The other area that might bring in some problems is through this deltoid muscle here. It's important to get this muscle that we stretch back. And we could take a stretch. You want to be real careful when you're stretching somebody back in this direction, because we really don't do this very often with the movement. But here's a nice stretch there. That's a very good stretch. And I'll do that one also on the other side. And what I'm doing is lifting the arm and then lifting the shoulder. Let her arm drop back down here. And then we'll do that. I'll look and see how much the scapula wings. So this is a nice, good stretch. If someone has spent a lot of time, hovering over a computer or doing artwork or doing forward bending type things, forward leaning things, these backward positions of the arm are going to be quite possibly very tight. But it is important to keep that stretching behind us, because it does another thing. When we stretch the arms back, it'll pull open the rib cage, and the shoulders won't tend to roll forward quite so much when we bring it back like that. So there's just a few more hints for you all out there, for your friends, your family, or even maybe taking it into your practice and trying a few other things that you might not have thought of before. Okay, thank you. This is Athena Jezik.